It's not a vaccine. It's basically something known as an adjuvant. Now this again I will talk later that what is an adjuvant. Adjuvant is something which basically adds on to the effectivity of your already taking medicine. That is, if you have a malaria, you cannot give anybody a vaccine for malaria. That is, if I have a malaria, give him this vaccine, that is which is in the phase 3 clinical trial. Okay, the name of it is moxicuric. Technical name is MVA85A. Forget about it. So that vaccine cannot be given for somebody who has got a malaria and give him. No, you have to treat him. You have to treat him for malaria conservatively, whatever you are treating, by your injections or by your tablets. And on top of that, to prevent the complication, जो complication हो रहा है उसको prevent करने के लिए, you give this adjuvant. So this is what it is. Adjuvant is basically helping you to make your treatment much better, prevent complication, and also prevent the relapses. Whether infected, treated, and again getting infected. To prevent all these things, this is used. So we don't have a vaccine for malaria. What we have is adjuvant, and limitations are there. It is only active against Plasmodium falciparum. The reason being because falciparum is the most toxic of the malarias. Most of the deaths of malaria, if you have ever heard, could be basically because of falciparum. Vivax is very common and does not actually lead into complication. So this vaccine, RTS, developed by Bill and Melinda Gates in the clinical 3 phase trial, is an adjuvant vaccine. Limitations are there. It will only help you to improve your condition, prevent relapses, prevent complications. Not actually given to treat malaria. Okay? So dengue we have understood malaria, we have understood TB. Now as I told you, these are the infectious diseases. The world has actually looked after the infectious diseases by vaccination point very well. But now the West is moving, that's what I told. West is moving from making vaccines for infection rather than infection. They have shifted their concern to other diseases which are maybe all burdening population for them, like degenerative disorders or carcinomas. These are the focus for the West now. So that's why there is a lot of development and research and money pool has been pumped in for these new vaccines which will come out in the future. We have already got some vaccines for cancer also, HPV, potentially cancer preventing. Okay. Now the concept of cancer vaccines have also changed. Rather than using the vaccine to prevent the cancer, see, HPV is not used to cure the cancer. HPV has been given only to prevent the occurrence of the cancer. Now the future of the vaccines are make vaccines so that they not only prevent the onset of the disease or prevent the start of the disease, but to make vaccines where the disease itself will be cured. So they will have therapeutic value, not preventive value. All the vaccines which we have for cancer, like for example hepatitis B, also prevention of hepatitis cancer, hepatitis HPV, again to prevent the cancer in advance. But the next generation of vaccines which will come up will be vaccines which will actually treat the cancer. Okay, that is for colorectal cancer, major problems in the West. Pancreatic cancer, major problems in the West. Okay, so these are the cancers for which drugs are made. So you see the focus has changed from infective vaccines to therapeutic vaccines, and that too basically for the Western population. More of vaccines for cancer, more of vaccines for degenerative disorders, more of vaccines for autoimmune disorders. Now this is the third category which has come, autoimmune disorders. Autoimmune disorders, we have never heard of any vaccine till now. But there is a lot of work going on in the West for autoimmune disorders. Most of the people may not be knowing what autoimmune disorders is. Basically a disorder where the disease occurs because of your own body's problem. Your body does not understand. Like for example, you have a security guard with you. The security guard is supposed to protect you, but the security guard itself kills you. In that, this is a rough explanation of what autoimmune, that your body itself is your enemy. A lot of conditions are there, arthritis, multiple sclerosis, lot many are there. Okay, so this is again focus area. So one focus area is basically preventing cancer, other focus area is preventing autoimmune disorders, and the third focus area which basically they have developed is basically the new type of vaccines which will be used for population which actually are contraindicated for vaccine. For example, who are the population which are contraindicated for vaccine? Babies. Not all babies can be immunized for all vaccines. There is an age limit also. For example, even this dengue virus which I told you, dengue virus, it has a limitation that it cannot be immunized before 9 years. Does that mean anybody cannot get a virus, dengue by 8 years? They can get. So there's a problem. You are leaving out that population of 0 to 9 who can develop dengue. It's not very effective after 45 also. So the window period for the dengue is 9 to 45. So these are the, so the third category will be from infectious to basically cancers, then autoimmune disorders. The third is basically make vaccines which will be used for everybody, no contraindication. Like babies are contraindicated many times, pregnant ladies are contraindicated many times, elderly are contraindicated. So a lot of work is going on this category, that vaccines which will be universal in application, irrespective of the age factors and all that. Okay, these are the third thing. Now the delivery system of the vaccines will also change. Okay, so I have told you briefly that many vaccines, HIV, shortage of time. So HIV again is a virus. It keeps on changing its outer coat. So every time you develop a vaccine, the virus is smart enough to change its cover. So the vaccine is left of no use in spite of spending so much of money. So there's no certainty. Companies don't want to pump in money. Okay, the third type of development which is occurring in the vaccine development is the type of vaccines we are going to make. I was telling you DNA vaccines, adjuvant vaccines. The DNA vaccines will be good vaccines because these vaccines actually will go and make the changes in your own body. The gene itself will be changed by introducing DNA vaccine, so that your body will already get the presence of the virus and makes antibodies on itself from its own self even before that has come. So that is modification at a very minute level. That vaccines are going to be the major thing in the future. Second thing which is going to be a major thing in the vaccine development is basically your delivery system. That is going to change, there is no doubt. Vaccine means always injections, always, most of the time. We haven't seen any vaccine which is in a tablet form. Okay, so this is going to change in the future. We are going to develop, in fact, this TB vaccine, which I told, which is going to prevent the complications, which I have told, is basically again taken in a nasal form. Nasal form, this is the thing. So nasal form, why? Because directly getting involved in the lungs. No? Lungs is the primary source for TB. So immediately it goes in the lungs and has its impact in the lungs. So that is the new type of delivery system you're going to have, not injectables. Second delivery system you're going to have is patch system, patch. You'll have a patch system where the delayed release, sustained release will be offering over a period of days or whatever efficacy the medicines are. So this is how the pattern has changed. The medicines, no new medicines have come, no new vaccines have come for TB, for malaria, for dengue because of lack of development in the West. We have to take the burden. We cannot always look at the West thinking they will develop for us. They will not. Second is the West has changed its focus from infection to other things where the market for them is different. And also the third thing is the pattern of the delivery is going to change. Injectables are going to be less. It's going to be more of oral, more of nasal or more of patch system. Okay? Thanks a lot. Thanks.
Thank you, Dr. Vaishali, Dr. Padmakar and Dr. Ashok for giving this valuable information to people who are reading. If you have any question, you can ask. You? Yes. All clear? Okay, thank you.
Thank you.